everyone, my name is Dr. Lisa Becht with HRC Orange County. In honor of Polycystic Ovary Syndrome Awareness Month in September, I just wanted to talk a little bit more about PCOS. So Polycystic Ovary Syndrome is very common. A lot of women actually may not know that they have it, so sometimes that's a new diagnosis when they come to see a fertility doctor, in which you need to have 2 of 3 criteria to make that diagnosis of PCOS. The first is having irregular cycles. For some women that might be just having longer cycles, over 35 days. For other women it may mean not getting a period for many months on end, but kind of having irregular cycles would be one of the criteria. The second criteria would be polycystic appearing ovary on ultrasound. As part of your consult, we do an ultrasound for you, and we look at the ovary and we see if your follicles, which are the big black circles, are spread throughout the ovary, or if they're more around the periphery of the ovary, which is what we call string of pearls in terms of that appearance on ultrasound, and that would be classic for polycystic ovary syndrome. And with that, typically someone with PCOS on ultrasound has many follicles, as well as typically bigger ovaries. And then the third criteria is basically seeing if you either have clinical, meaning laboratory signs, or actual symptoms of high testosterone levels. And so that would be something where we either can check different what we call androgen panels, including testosterone levels, or if it's more from the symptom side, potentially you might have increased acne or increased facial hair. So those would be all things that we could go over at a consult. And from using this criteria, if you do have 2 of the 3, we would say that you fall on that PCOS spectrum. And from that, we could do some further testing. Typically for PCOS, we do a full workup beyond just looking at the PCOS, just to make sure we're not overlooking other fertility issues. So that would mean checking your fallopian tubes with a hysterosalpingogram, checking the sperm, and a bunch of other just general fertility tests. And from that, we can make a decision as to what would be the best way to treat you for fertility with PCOS. The good news about PCOS is because you do have many follicles with many eggs, typically we do get a good number. Sometimes with PCOS though, we do see some of the quality of some of the eggs might be a little bit less than expected for age. So we put that all together and at a consult, once we've gone through all of your testing, could give you a little better idea as to how you would do in a cycle. This is PCOS Awareness Month. I just want to let you know that we're here for you. While definitely getting a diagnosis of something like PCOS can come as a shock, especially for someone who comes in, really wanting just to talk about fertility and they walk out with this diagnosis. Just wanted to let you know there's a lot of resources. The great news is that there's many different ways to treat PCOS, and hopefully we can help you be successful in attaining your dreams of having a baby.